Back in January, pharmacists around Saskatchewan saw expanded roles, allowing them to test and prescribe for strep throat and ear infections as part of a pilot project. Now, 6 months into the year, the project is seeing success. Joining us for more details is Michael Fougere, CEO of the Pharmacy Association of Saskatchewan. Thank you so much for being here, Michael.
My pleasure. Good morning.
So to start us off, maybe let's get a little overview of what the project is.
Well, this is expanding the scope or the kinds of things that pharmacists can do. And the province and the Ministry of Health have been very supportive of saying pharmacists can do more to help patients, more access to health care, particularly in rural and remote Saskatchewan. So the pilot is really for ear infection and for throat infection or strep throat. A pilot for, I believe it's 11 pharmacies can do the strep throat, 35 can do the ear infection. So it's been very successful, and we always like to have more pharmacies involved, but as a pilot, this is a good first step. We're looking forward to expanding this right around the province.
Very interesting. Yeah. Such an incredible project we've got going on here. Mm-hmm. And what are the numbers that you're seeing from the pilot so far?
Well, so far about 3,135 patients have been seen for the past 6 months, 745 for sore throat, and about 2,300 for the ear infection.
Okay, and let's maybe talk about what those numbers might indicate moving forward.
Well, we know there's hotspots where there is strep throat in southern Saskatchewan in particular. There's some issues there, and therefore we've been able to address those. Again, this is about access to health care, which otherwise would not be provided. And what's good about this is that there's a point-of-care test device in the pharmacy that can actually do the test and give you the results in about 7 or 8 minutes, as opposed to traditionally going to a lab and coming back again. And the pharmacists can prescribe the medication for that as well, which is brand new, both for strep throat and for ear infection as well.
Wow, okay, very important, very interesting.
Yep.
And let's maybe talk a little bit about why it is so important for pharmacists to expand their roles, and especially in those rural communities.
Well, pharmacists are trained to do this work. They have to have the authority given to them by the College of Pharmacy and the ministry. So this is, again, about healthcare access, and we know that there's a shortage of healthcare workers everywhere, right around the country, not just in Saskatchewan. So if we can provide greater access to healthcare for pharmacists, because they, in many cases, in small town Saskatchewan, they're the only healthcare professional around. If they can provide more healthcare coverage, we all win for that.
Absolutely, absolutely. So you're seeing less of those maybe in those rural communities, which is why, pinpointing those are so important.
Exactly. And of course, if we expand this province-wide, the public will be the big beneficiaries of this, because we'll have, again, greater access, and it will allow pharmacists to have more authority to do what they want to do and what they're trained to do. And so it's better for the healthcare system, no question.
All right, and where can people find more information?
Well, they can go to the Ministry of Health or the website, or they can go to saskpharmacist.ca, our website, to see where they're located for all these tests to be done.
Amazing. Michael, thank you so much. This is so important, and I really appreciate you being here this morning.
Thank you.